Well, during this pandemic, we've heard a lot about antibody testing. Those are the tests that are supposed to determine a past infection of COVID-19. But in new guidance, the Centers for Disease Control and Prevention now say those tests aren't always reliable. Mandy Gaither has some additional information in today's Health Minute.
Antibody tests to determine if a person has had a past infection of COVID-19 may be wrong up to half of the time, the CDC now says.
I don't think that we should be making any decisions using those antibody tests.
Dr. Sanjay Gupta says a lot of the antibody tests initially put out weren't good. The FDA has since put out a policy requiring antibody test makers to submit emergency authorization requests along with proof the tests work.
False positive is the worst kind of result, right? Because then you think, well, I've got the antibodies, I'm good to go. You're not, and so the tests aren't good enough right now.
The CDC says health officials or healthcare providers using antibody tests need to use the most accurate tests they can find and might need to test people twice.
Also, we still don't know the exact meaning of what the antibodies are going to provide in terms of how long people would be protected as a result of having these antibodies, how strong that protection would be. It's likely they're going to have some protection, but we just don't know the extent of it yet.
For today's Health Minute, I'm Mandy Gaither.